Hello and welcome to Carlos and Lisa. I'm Lisa Remillard.
And I'm Carlos Amesco. It's nice to have you with us. Have you ever heard of a broken heart?
Yes, I have had multiple of them, haven't you? I think we all have, right?
Of course, we've all suffered, kind of the pain of a loss or a broken heart from a loved one. But have you heard that people who die within just weeks of each other, like elderly couples who die of a broken heart because their spouse died, they spent 60, 70 years together and suddenly the other partner just can't live without them, and they die.
It's called broken heart syndrome, and it is real. It's not made up. It's also called a stress-induced cardiomyopathy, which is kind of the technical term for it. But here's the interesting part about it. A new American Heart Association study finds that broken heart syndrome could also be linked to cancer.
Oh, boy, that's taking it a step further. Okay,
How about that?
So people, I can see from sadness that, but let's talk to a doctor about that, shall we?
Because we probably should.
We probably should do that because, I Googled broken heart syndrome and it's on my Google. But as you know, we should always consult a doctor before you consult Google. Joining us from the University of Kansas Health System is cardiologist Dr. Andrew Sauer. Nice to have you with us, doctor.
Thanks for having me.
Okay, are we full of crap? I mean, or is broken heart syndrome a real thing? And is the link to cancer real?
No, I don't know if you're full of crap. That's a different question. But broken heart syndrome is definitely a real thing, and we've known about this for a long time. And there's various forms. Stress is the common contributor, and we do see quite a bit of this in the real world.
So let's talk about the symptoms of broken heart syndrome, because it mimics a real heart attack, right? It can.
It certainly can. It can mimic a heart attack. It can also mimic heart failure, which is my focus as a practice in cardiology. And so it can present a number of different ways. So shortness of breath and chest pain, feeling lightheaded, passing out, life-threatening heart rhythm issues. All of those can be manifestations of the broken heart syndrome.
Wow. Now, what I found fascinating about this study is the link to cancer. I don't understand how those two can be connected.
I think we are also struggling with exactly identifying the link. I think there's a couple things to point out about cancer that might link the two. One, cancer, as you can imagine, is a very stressful event, and any form of stress, whether that be cancer or a death of a loved one, or even sometimes good stress like the marriage of a loved one, can be a contributor. But also, patients who have cancer receive medicines like chemotherapy, radiation that can injure the heart and make it more predisposed to weakness, which is what we call cardiomyopathy.
Boy, that's really
that is interesting.
So here's the thing about stress, and that is that it sounds to me like your brain is taking over your body, because your brain is where all the emotion comes from. And if you're stressing your heart out because you're so emotionally distraught over whatever's going on in your life, it actually can not only strain your heart, but ruin your entire health system.
That's right. And when you're in a stressful moment of life, you have adrenaline coming from your brain and the other organs in your body, high steroid levels, corticosteroid levels from stress. And we believe that is the link that is a major contributor to causing the heart muscle to be weak. That's right.
Wow. I want to know, doctor, in your practice, in your everyday, I know you are in charge of heart transplants. Is that correct? At the University of Kansas Health System?
Yes, I'm one of the cardiologists that leads that program, but I also focus on cardiomyopathy and heart failure.
Okay, so I want to know, in your day-to-day routine, how common is this? How much do you see it in your practice, in your day-to-day practice?
I see about 5 cases a year, so it's not extremely common, considering that we care for hundreds and thousands of patients every year. But when you see it, you kind of know it when you see it, and it's oftentimes patients that look like they're having a heart attack, and then you do an angiogram, which is where we look at the arteries of the heart, and you find there's no blockage causing the heart attack, and then you sort of go back and you figure the diagnosis out when you piece through the history.
Okay, so people are freaking out at home right now, thinking, well, I'm
I have a broken heart.
I'm kind of sad and I'm feeling badly. And so, what are the symptoms that are absolutely 100% telltale signs that you do have a heart condition that you need to take care of, as opposed to one that's a broken heart.
Yeah, I don't think there's any reason to panic or freak out. This is, again, an uncommon presentation, but it's real. And I think if you're having a stressful event and you're also experiencing symptoms of chest pain, shortness of breath, can't walk very far without getting winded, it would be very prudent to call your doctor and let them know what's been going on and be checked out. A basic EKG and echocardiogram or ultrasound of the heart would help establish whether there's any concern at all.
Wow. All right, Dr. Andrew Sauer from the University of Kansas Health System, thank you so much for your time and your expertise. We really appreciate it.
Great talking with you.
Thank you so much.
All right, isn't that fascinating?
Really
Fascinating, right?
really
All right,
interesting stuff.
We'll be right back.